Hello everyone and welcome to my health medicine. In this video we are going to talk about the fungal infection called mucormycosis, which was also known with the name zygomycosis. It is a very common fungal infection seen in people, and it is also known with the name black fungus just because the most common symptom of the disease is black patch around the affected area. It is a serious infection generally seen in people with low immune systems or those who are having meaningless ability to fight with infection. The disease is generally spread by eating contaminated food or getting spores of molds that are present in air. It is a rare disease with only 1.7 million people per year around the globe. But as in any other case, our India is not behind and are more vulnerable than any other country. The first ever case of mucormycosis was described by Friedrich Koch-Minster in 1855. He was a German physician. Generally, mucormycosis is classified into 4 types according to the part of the body which is affected. Rhinocerebral mucormycosis, in which the brain and sinuses are the affected part by the fungal infection. It is most common in people with poor controlled diabetes and who had kidney transplants recently. Secondly, there is a pulmonary mucormycosis in which lungs are affected by fungus. It is the most common type of mucormycosis among other types, mostly seen in people with cancer and who had an organ transplant or stem cells transplant. Thirdly, there is a gastrointestinal mucormycosis in which stomach and intestine is the affected part by the fungus. It is more common among young premature and people who are having antibiotics surgery and having the medications that tend to lower the ability to fight with infection. Lastly, there is a cutaneous type of mucormycosis seen in people who had cut on any of the body part and are exposed to contaminated water or contaminated air. Signs and symptoms may depend on where the infection is. The person may appear to have sinusitis, fever, cough, chest pain with difficulty in breathing. When in special case of gastrointestinal mucormycosis, person may also suffer tummy ache, nausea, vomiting, and in rare cases bleeding can occur. The fungal spores are everywhere in air, but some people get caused because of low immune system. In addition to being breathed through the nose to the lungs, spore can also enter through the cut or wound in the skin and is the cause of cutaneous mucormycosis. Risk factors may include less ability to fight infection, having a very low neutrophil count, which is a type of a white blood cell, metabolic acidosis, poorly controlled diabetes mellitus, organ transplant, iron overload, with cancers such as lymphomas, kidney failures, and long-term consumption of steroids can also be the major cause of mucormycosis. If the mucormycosis is suspected, initially Amphoterecin-B is given slowly into the vein with injections. Amphoterecin-B is antifungal medication for serious fungal infections such as aspergillosis, blastomycosis, and of course mucormycosis. If the medication doesn't really help, surgically removing of fungal ball is then indicated. In some cases, removal of infected brain tissue may be required in rhinocerebral mucormycosis. Lastly, but not the least, prevention measures such as wearing a face mask in dusty areas, avoiding direct contact with contaminated water or contaminated air, protecting skin, feet, hands, and other vulnerable body parts for being exposed to fungus that can cause mucormycosis. In high-risk groups such as organ transplant, antifungal drugs may be given as preventative. This was the only information in this video. If you like the content in this video, please do subscribe our channel Health Medicine, and please hit the thumbs up right below. Thank you so much. We are now available on such media platforms. Check description right